Okay, we are live. We should be going live now. I'm just gonna double check our status on our page. Sometimes that's the only way I can see. So as folks are entering the space, yep, we're live. Hey y'all, welcome. Welcome to our Facebook Live, our monthly Facebook Live, claiming voice, centering stories. We're talking about transforming our maternal health care system through advocacy and action. Today is a real special treat, you all. And as you continue to kind of enter the space and get settled, we really want to open up today's session, our time together, by just centering it with gratitude. We are so appreciative that you all are here, that you are dedicating a part of your lunch hour to talking with us and hopefully being inspired by some really enriched conversations. Before we start too, we also want to shout out and thank our Mississippi Perinatal Quality Collaborative. The MSPQC is a champion for just championing safe, equitable prenatal care. And we are so thankful for them supporting forums like ours, which we hope foster and inspire continuous learning, open dialogue, and improvement. So, my name is Lejeune Johnson. I am a licensed clinical social worker. I'm also a certified perinatal mental health therapist. I'm really excited to be here today with our special guest, Dr. Leslie Farrington. I'm going to do a mini talk about Dr. Farrington. I'm pretty sure I won't do her intro justice, but Dr. Farrington is a retired African American gynecologist. She is extremely passionate about birth justice and being an advocate for birthing justice. I've been following her for about the last 2 years. I'm so thankful I got introduced to her. I think I was introduced to her through Black Mamas Matter Alliance, and it has been so great to be able to follow her throughout her career. She's dedicated herself to transforming perinatal and medical experiences through community-driven advocacy, education, and just crafting solutions as to how we can improve and advance maternal health care systems. She has a strong background in grassroots patient safety. She co-created the ACT, and that stands for ACTT curriculum, and she also co-founded the Black Coalition for Safe Motherhood, which promotes the ACT Advocacy Toolkit in Black communities across our nation and beyond. So today, Dr. Farrington is here with us to lend her powerful voice as to how we all can become advocates for safe, equitable maternal health. And so to begin and kind of open the floor, I would love for Dr. Farrington to share with us, what inspired her to advocate for maternal health and enter this space.
So thank you so much for having me, Lejeune. I'm grateful for this opportunity to share what a lot of people don't think about, and that is patient safety, health equity, and eliminating racism in healthcare. So those are my focuses. Around 2006, I got involved in the grassroots patient safety movement and joined an organization at my church at the time, which is now called Pulse. The organization is called Pulse Center for Patient Safety Education and Advocacy. And there I learned, as a physician, I was a practicing OBGYN, I learned how medical mistakes happen. At that time, I became especially concerned about misdiagnosis, basically from not listening to patients. So in 2009, I left a busy hospital practice to slow down and to listen to my patients. By then, I knew that safe quality care required slowing down and listening. I was struck by a recurring theme reported by young sisters who were coming to me as new patients. So these young women, their previous doctors had assumed that because they were Black, that they had had an abortion or sexually transmitted disease. And as a result, they felt disrespected and they lost trust in those physicians. I believe that physicians who hear these recurring narratives of biased care from their Black patients, they will gradually develop a sensitivity and a mindfulness to avoid stereotyping in their evaluations and the treatments of people they serve. So I think it's important to tell your story of previous mistreatment and set that expectation of respect for yourself as an individual who is seeking personalized care. And so telling your story, which is part of what ACT stands for, telling your story, it sets the stage for partnership and better communication. And good communication is key to patient safety. Better communication is a key to improving experiences and outcomes. And empathic support from your medical professionals, it really promotes healing. And so listening attentively, that puts people at ease, it builds trust, and it promotes healing. That's my been something that I'm trying to emphasize, that all consumers of healthcare have to speak up for themselves, tell their story, and advocate for themselves. And that's how they're going to change at least the care in their particular situation.
Absolutely, absolutely. And thank you so much for just sharing and reflecting on what inspired you in your life's work into entering the maternal health space and then also being so dedicated to equity, which is huge. I agree with you 100%. The power of storytelling is so it's moving. It connects us with people. Our stories connect us with people. And so, my first introduction, I'll briefly share to the power of storytelling, really occurred when I joined the Mississippi Maternal Mortality Review Committee. And just FYI, for those of you who are on the call who may not be familiar with maternal mortality review committees, they're also called MMRCs. These are an interdisciplinary team of professionals that come together that review maternal deaths. And reviewing these maternal deaths, oftentimes they look at their medical records to see if there were any gaps in care or if there were any protocols that were not followed or any scenarios that could have been prevented that led to their death. And so when I came on board to the Maternal Mortality Review Committee, I came on with a task. They wanted me to reach out to the family members of the decedent, of the woman who passed away, to gain more clarity about who this woman was, information about her pregnancy, information about the postpartum period, because what committee members quickly learned was that medical records don't tell us the complete story. They don't give us a complete picture of who this woman was and her life lived. And so capturing the stories of this person whose life mattered through their family members or next of kin is a way for us to gain more insights, about emotional struggles, economic distress, mental health conditions that may have contributed to her passing as well. And then also a big one is discrimination, bias. Did she have any of those experiences? And I think that you are so right. And I know we'll talk about this a little later on, is that these experiences they shape our perception of what it means to pursue prenatal care, or even, for some folks who've had really extremely challenging experiences, sometimes that can be a reason for them to not want to pursue prenatal care. So I agree with you 100% on all fronts. And so, in that same spirit of honoring the power of stories, I wanted to turn back to you to ask, as an OBGYN, what first opened your eyes to the power of patient stories in shaping how we deliver care to them?
So what I've learned is that um, support is clearly one of the most important things that people who are going to give birth really need to have a healthy pregnancy. So that means, and part of that support is listening, it's empathy, it's whole person care, and it's one reason why culturally congruent care improves outcomes. So we know that Black people have better outcomes with doctors who look like them. They're more likely to feel that they're heard and that their story is valid. And all of this makes a person more comfortable. They can heal. And there's been so much trauma through the life course for, just growing up Black in America, that
Mm-hmm.
the last thing we need is situations where the doctors are experience is a stressful experience. So we want to have more listening, and that we know that listening and support will improve outcomes. If the midwives are known to spend more time with their clients than doctors, and they call it whole person care. And I'd like to give the example of midwife Jenny Joseph. So to show how people's stories and so that kind of empathic support makes a difference to the outcomes. So when we were still, can you still hear me?
Yeah, I can hear you. Yeah.
Okay. So I have a different screen popped up, so I'll just continue. Midwife Jenny Joseph's JJ Way is supportive perinatal care, and it's a great example of how to improve outcomes. It blew my mind when I first read Jenny's 2015 report on her success in eliminating disparities in birth weight and prematurity in Orlando, Florida. At her clinic, the Easy Access Clinic, birthing families are embraced in a welcoming, family like atmosphere as soon as they show up to her clinic. And the midwifery model emphasizes listening to the birthing person's story. It was around this time that I began to see just how tragic it was that the traditional midwifery was eliminated in the early 1900s by a campaign by doctors and hospitals at that time. So, from a medical standpoint, so Jenny Joseph, with the supportive care that her clinic gives, she reduces C-section rates. She eliminates birth weight and prematurity disparities, and so that is one way to improve outcomes is to really give that holistic support, and hearing the patient's story is a key part of that. Now, from a medical standpoint, listening to the patient's story fully and reducing the tendency to interrupt can reduce misdiagnosis. A quick description of symptoms may not give enough context to make a correct diagnosis. And that can lead to dismissal also of their concerns as insignificant or not worth spending time on. So, the story that a person could tell about their reason for seeing the doctor or midwife can give a clearer picture of a potentially serious condition, which would require further observation and maybe life saving. We all know the situation where the mother who comes in labor is told, "Oh, you're too early to be admitted." And sometimes they get sent home. And sometimes that is a poor decision. So if they had listened to the patient's story before deciding whether or not they should be admitted to the labor floor, then they might say, "Oh, well, you should stay. You should stay," because if so, they suppose they say, "Oh, we live too far away," or maybe my first baby came so quick. These stories can alert the team that the woman has fast labors.
Mm-hmm.
Or maybe her pain is getting worse and she needs to be admitted for pain relief. So, and we've all heard the stories of births happening in cars and by the roadside after being sent home from the hospital. So we need to listen to the patient's stories to improve outcomes, definitely.
Absolutely. I love everything. I love the two examples that you provided, number one, but I also love how those examples centered around storytelling are linked to shaping care, setting expectations, building trust. All of those things are huge with storytelling. And I know those are also reoccurring themes that we'll address as we continue to have our conversations. But yeah, we shouldn't just look at our stories as reflections, but these can also be roadmaps as to how we deliver care. Um, and I love how you also just talked about those themes about, trust, and how when we dismiss, a woman's thoughts or feelings and not recognize that they are experts of their own bodies and what is happening within their own bodies and the concerns that they may have, that leads to mistrust. That leads to mistrust with our providers, mistrust with systems. And so, it also can be linked to themes around, how we experience birthing traumas, right? And those things can definitely lead to traumas as well. So I really, really appreciate you highlighting those things. So with that in mind, I'd also like for us to maybe talk about um, how, and it links kind of to what you were just talking about with those examples that you gave, how listening to not just stories, right? Or no, I'm sorry, how listening to stories and not just the symptoms, not just the symptoms that our mamas are giving us, impact how we deliver maternal care, or impact how we should deliver maternal health care. Can you hear me? I'm sorry. I think you froze.
Can you
Are you
repeat the
frozen?
question?
Oh, yes, ma'am. Of course. So when we were talking about listening to stories and not just symptoms, I'm wondering, like, what are your thoughts about how listening to stories can help impact outcomes in maternal health care? So how stories can shape maternal health outcomes.
Oh, okay. So, so we can use the lived experience and the stories. We can use them to function as data to
Mm-hmm.
influence clinical policies, etc. And
Mm-hmm.
I think so. Putting not just individual stories, but taking lots of stories and putting them together. So we could influence. If we talk about individuals, we could talk about uh, the individual influencing her doctor to treat her in a different way, and if you talk about large numbers of stories, you can put them together and influence the way care is rendered at hospitals, and and how policy is shaped. So, and I have two major examples of this, of taking lived experience and turning it into data. And the first one would be the Earth app of Kimberly Seals Allers, and the other is the Prem OB scale developed by Dr. Karen A. Scott. Dr. Scott is an obstetrician and epidemiologist who developed the Prem OB scale as a validated measure of obstetric racism. And she collected the stories of over 800 Black birthing individuals. And I think it's best if I quote her report published in Birth, the journal Birth, in September 2022. And she says, perinatal quality improvement lacks valid tools to measure adverse hospital experiences disproportionately impacting Black mothers and birthing people.
Mm-hmm.
Measuring and mitigating harm requires using a framework that centers the lived experiences of Black birthing people in evaluating inequitable care, namely obstetric racism. We sought to develop a valid patient reported experience measure, PREM, PREM, of obstetric racism in hospital based interpartum care designed for, by, and with Black women as patient, community, and content experts. again. So she's saying the lived experience
Mm-hmm.
makes these Black women as the patient, they are the patient, community, and content experts. The PREM-OB scale suite is a valid tool to characterize and quantify obstetric racism for use in perinatal improvement initiatives. So we're talking about the traumatic experiences that you made mention of. These
Mm-hmm.
are part of the negative outcomes that are not acceptable. So this
Absolutely.
is a measure that Dr. Scott developed by through interviewing and listening to the lived experiences of 800 Black patients across the
Wow.
country. So clearly, all hospitals serving the Black community should be using the PREM-OB scale to prevent
Mm-hmm.
harm and support the strengths of birthing families. And Dr. Scott has a new book which includes stories from 36 Black moms. So she did focus groups, which shows how hospitals cause harm to Black birthing families and how they can change. So it's a roadmap for them to change. And I encourage listeners to pick up Sacred Birth, and it's spelled SACKRED Birth, mobilizing a new quality paradigm in obstetric care. So that's something that we can look forward to. Um, Lots of folks who are developing policy or trying to um, bring equity to their care, they have a resource right there.
Mm-hmm.
Then we
Now,
have Earth. Go ahead. You have a question?
no, 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 no. I'm listening. I want to hear more about Earth.
Okay.
Yes.
So Earth is birth without the B for bias, created by Kimberly Seals Allers. The Earth app is where Yelp like reviews of perinatal and newborn care can be left and found by Black birthing individuals and their supporters. And this is a resource for the communities with thousands of reviews. So if you have a lot of reviews, and this is what we need to do, we need more reviews. So if you get thousands of reviews in certain areas, for example, New York or Milwaukee, wherever, then you've got a great resource for those who are seeking care and want to get care that's respectful and quality care for them, even as a Black, a brown person um, getting care. So it's a resource for Black and brown families, but it's also a way by taking when wherever there's a large number of reviews, taking those reviews and turning them into data to be feedback to those hospitals in those areas.
Mm-hmm.
So so Kimberly has developed a whole system and is now working with 8 organizations or hospitals in 6 states so far. There are contracts with those organizations and hospitals to improve their care. So we're building accountability into the system by using these lived experiences, and I'm so excited about that. So
We all should
I'm
be.
yeah, we need so all birth workers, social workers, if you within the sound of my voice and you have contact with birthing people, Black and brown birthing people, have them do a review so that this data can be um, used on the back end. It's de-identified and it's amassed in such a way that feedback can be given to hospitals that want to do better. So
Yes.
we can, and then we hope to that they can get like the seals of approval for doing what it takes to make their care responsive to the Black community. So
Absolutely.
those are two great examples of taking lived experiences, stories, and turning them into data that can shift the culture of perinatal
Wonderful.
care.
That
Yeah.
is huge. And we have the link dropped in the chat for the Earth app. Thank you so much for sharing about the Prem O. And I've been in the maternal health space for some years now, and I have never heard of the Prem OB scale nor the Earth app. But I love how those platforms are showing us that lived experiences aren't just personal stories. They also can be validated tools. They can provide us with metrics and accountability systems that can help us drive change. Because a lot of times when we're trying to, initiate change or change systems, a lot of times they want data to back that up. And these are very practical ways that we can implement that. So I think that is amazing and wonderful. We're talking about evidence based and recognizing that there is a growing body of literature that's telling us that storytelling and lived experience can be also considered evidence based practice. Right? We know that these stories are not just stories. They can also be qualitative data. And this reminds me of Dr. Lucinda Canty. I don't know if y'all know about her, Dr. Canty. She's on LinkedIn. She's on a lot of different profiles, but I follow her on LinkedIn. She's amazing. She has some work centered around the lived experience of Black women who have endured maternal morbidity. And I believe the name of the article that you can pull up is The Lived Experience of Severe Maternal Morbidity Among Black Women. And in her article, she examines the lived experience of severe morbidity among Black women in the U.S. And so what she was able to unveil through this study was themes of delay, dismissal, being provided disrespectful care. And again, this information is so vital because we can't change what we don't acknowledge or what we don't capture. And so, and while this is great, and I just love that we're resource sharing here because we need more of this, right? We need more data on the power and impact of storytelling or these qualitative interviews. We need more platforms like the Prim OB scale and the Earth app to help us in our quest to drive systems change. So yes, I love, 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 love that. So, but now I kind of want us to navigate into talking about this amazing work that you co-developed, the ACT framework. And I have just fell in love. I went on your website and I watched all the videos, the video scenarios. They're so relatable, especially because I've worked on maternal mortality review committees. And so the scenarios are quite reflective of things that we've seen that can lead to, unfortunately, a maternal death, right? But we need to normalize that these things can happen so that we can do what we need to do to prevent them. But I would love for you to maybe talk with us a little bit more about the ACT framework, and what it means for us in terms of empowering birthing people of color in clinical spaces.
So ACT stands for Ask Questions Until You Understand the Answers. Ask questions until you understand the answers. And I would even say until you're satisfied with the answers, until the answers make sense to you. So that's the A. The C is claim your space, both physical and mental, meaning your bodily autonomy and your dignity and self-determination. So claim your space, that's the C. Trust your body. That means don't dismiss your symptoms. Just because someone else says, oh, you're just in early labor. It's too early to admit you to the hospital. Oh, that's just a little spotting. That's not serious. Don't let them dismiss your symptoms. Be clear of what you're concerned about, and then tell your story. Mm-hmm. Tell your story means make sure that what you're concerned about is heard and addressed, and get the help that you need to make your concerns heard. So that means bring someone with you. And if we could have put a fifth letter in there, it would be something to relate to the issue that it's important to bring someone with you. And whether you're pregnant or not, this is important. Young or old, whatever you look like or whoever you are, unless you're a cis white male, you need someone with you in that doctor's office to get the respect that everyone deserves. So ask questions, claim your space, trust your body, and tell your story. Telling your story can also be healing if you've been
Mm-hmm.
through a traumatic experience. And telling your story can others can learn from your story, whether it be the provider or others who've been through the same thing that you've been through. So that's what ACT stands for. And what inspired the creation of the ACT framework, and I have to first give credit to midwives like Mama Shafia Monroe, midwife Nubia Earth Martin, uh, doula and physician assistant Darlene Turner. These are three people who are named as contributors in the curriculum, the ACT curriculum, but there are many people have helped put this together over the years. I've been mentored by several people, and it's been, you could say, built upon by the participants in our ACT workshops. So participants in our ACT workshops actually contribute more tips and tools that can be used to act.
Yes.
So what inspired me to really spearhead it in the beginning was the recognition that the safety of Black consumers of healthcare was really dependent on their own self advocacy to a large degree. In every research survey that you read going back decades, you will find that at least 30% of Black patients report discrimination in medical
Mm-hmm.
settings. And the CDC recent surveys confirm this among Black mothers.
Mm-hmm.
Mortality review committees reports show that discrimination is a contributing factor to 30% of deaths of birthing persons. In New York State, in 2020, when this was, that's when the last data that I'm familiar with, when that was came out, it was 46%. Discrimination contributed to 46% of the deaths. And this is not getting better. We know that from 2023, the maternal deaths in the United States had declined for every ethnicity except for Black mothers.
Yes.
And it even had ticked up a little bit. So this is
Mm-hmm.
not going to get better, especially with everything that's happening now. So,
Mm-hmm.
but I also want to emphasize the the deaths and the severe morbidity is a tip of the iceberg of harm that is being experienced by Black families giving birth in hospitals, etc. So, I was aware of this, as a white presenting Black person. My mother was white. I look like my mother. My father was a dark skinned man, and he instilled in me a Black identity. And so, as during my career, I did start to notice that there was bigotry involved in the care. And this sort of shocked me because I thought in healthcare, you shouldn't have any kind of discrimination. But that's what gradually I realized that what the bigotry actually translated into harmful care.
Mm-hmm.
I had my own little silo where, I had a tendency to practice like I thought a midwife should practice. That was because I was going to be a midwife, and then I decided to go into OB. It wasn't my decision actually, but that's a long story. I was told that you can't make a living as a midwife. This was back in the early 70s when I thought that's what I would want to do. So, but I digress. The grassroots patient safety movement was my first inspiration, and I learned about the alarming incidents of preventable harm in the United States in about 2006. And depending on what you read, between 250,000 and 400,000 people die every year from preventable medical mistakes. So that's when I started volunteering with Pulse Center for Patient Safety. We launched the Family Centered Patient Advocacy Training. And I learned back then that effective communication is key to patient safety. That means listening to patients' stories. In 2014, I learned about that maternal deaths had doubled in the US, while everywhere else in the world, the death rates were declining.
Mm-hmm.
So I was especially alarmed about the racial disparities. And then by then, I also knew that doctors were indoctrinated in what I call physician supremacy. And I experienced that indoctrination. We think that because we go to school for so many years and go through several years of training, that we know better than everybody else, and we tend to try to be the boss. And we have a lack of humility because of this indoctrination. And this, I say this, there are some doctors who do have humility, who do listen, but we have to be careful as consumers of healthcare to really protect ourselves from those who don't realize that they're affected by this physician, what I call physician supremacy. And I learned about it from a physician, Dr. Lucien Leap, exposed. He's a physician and public health expert. He exposed the disrespectful physician behavior ranging from outright abuse to more subtle resistance to quality improvement efforts. He outlined how institutions play a role in fostering disrespectful behavior. So, and I see physician supremacy as a part of, or a just a part and parcel of the white supremacy culture. And so, knowing that the system is unlikely to change, I wanted to spread a practice of self protection from discrimination, from patriarchy, paternalism, etc. So I saw it as a SOS situation. That's what midwife Nubia Earth Martin called it, and I believe her. It's a save ourselves situation, and ACT is one powerful tool in our toolbox. Over the years of offering free workshops once a month, we have found from our post-workshop surveys that 90% of participants feel more confident asserting their rights, communicating with their health care providers, partnering with the providers that do listen to them, and leaving the ones that don't. So that's, and it's a practice. ACT, we practice how to do it. We practice in groups, community groups, and we listen to each other to learn from each other. How would you say, what would you say if the doctor's talking to you about answering a question and you don't understand what they said? What would you say? So we go around the room. It's a Zoom room usually. And what would you say if if you disagree?
Mm-hmm.
We know that mothers are more at risk for mistreatment if they disagree.
Mm-hmm.
So this we practice how to advocate in our ACT workshops, and we train ACT facilitator. We train ACT workshop facilitators to offer ACT practice in communities across the country.
I love that. I love that so much. One reflection, and then I want to follow up on 2 points that you made in talking about ACT. One of the things you shared was, what we are experiencing when it comes to maternal mortality, maternal morbidity, with Black women just being the tip of the iceberg. You reflected on that recent CDC data capturing how maternal mortality has declined across demographics, with the exception of Black women. For Black women, it remains, unfortunately, jarringly high, and then for certain regions of the U.S., exceptionally high. I actually live in a region in Mississippi where we are 45th in maternal mortality. We are up there, but when you talk about it just being the tip of the iceberg, that's for sure, because we also know that it impacts our babies. In Mississippi, we are actually number one in infant mortality. So these unhealthy pregnancies, being at risk, definitely have definitely can lead to complications with our pregnancies. And that's also something that we have to look at, because also in Mississippi, there is racial disparity in infant mortality. Our babies are twice as likely to die before their first birthday, and like you said, it's just it's a trickle down effect. That is just the tip of the iceberg. And then also what you shared about the ACT the ACT framework, I love what you mentioned about trusting your body, empowering women to know, hey, you are the experts of your body and what you are feeling. Your intuition is important. And I can't tell you how many, I worked in a maternal health clinic for several years, and I can't tell you how many women came in and expressed, well, I went in, I wasn't feeling right, and I thought I was having a stroke, and then the doctor said, you're too young to have a stroke. Or I go in with labored breathing, and it's normal. Being out of breath is just normal in pregnancy, but it can also be not normal, right? And unfortunately, those situations leading to severe complications. But unfortunately, for some women, those scenarios may lead to death. And so I love what you just shared about trusting your body, feeling empowered that, hey, I know that something is wrong here. And, I just really can't underscore how important helping women feel empowered is when it comes to talking to our providers and speaking up. You also talked about, and this is what I love about the ACT framework too, about how you integrated the voices of those women and how you shaped your tool and how you refined your tool. I'm a huge advocate of, you know, the thought of thinking that the communities that are most impacted should be reflected in how we provide care or how tools are crafted. So I love that you talked about how integrating the voices of those women into the ACT framework. I think that is huge. I love that a lot. Um, and in that same regard, I'm wondering, how do you see the ACT model being used by your patients or by patients by facilities who are implementing the ACT framework? How do you see this is evolving, or how are Black women responding to this?
Well, the women are responding very positively to it. The families, the fathers, we have ACT. Every other month we do ACT workshop. We call it the ACT for Dads and Partners workshop. So we're trying to get the whole family, the whole community involved. Um, so yeah, that's and I love the quote from one participant from one of our earliest workshops. She said, "What I learned is that the provider, the doctor, whoever it is, they need to be my partner, and I would say to them, you are not the boss of me." And so you are not the boss of me. It really captures it for how mothers take to it.
Mm-hmm.
Um, yeah, because older women say, "Oh, I wish I had known this when I was having my baby." People just listen to the doctor, and they
Mm-hmm.
don't realize how much of the doctor's practice is not evidence based, or it's based on what's easier for them, sometimes what's more lucrative. So you really have to get them to stay on point and use get them to use evidence. And there is a whole system of education and a resource in the evidence-based birth uh,
Mm.
program, so
Yep.
everyone can find the evidence. And I think it's a great idea for consumers of healthcare, maternity care, to show their doctors, this is evidence. Look at the evidence, please, doc, on whether or not I should be induced just because I'm 40 weeks. You
Mm-hmm.
know, or there's so many topics there, and they have a lot of podcasts on equity as well. Um,
Wonderful.
yeah,
Evidence
yeah.
based birth. I think they're on
Evidence.
Apple Podcasts or Spotify. If y'all are
Well,
interested,
yeah, and
tuning
evidence-based
in.
birth is it's a great resource to look up anything you want to look up about what is evidence for this before
Mm-hmm.
you go to the doctor. So knowledge is power, definitely, and everyone needs to do childbirth education. They've shown that 3 hours of childbirth education can improve outcomes. Also,
That's
I'm all about
beautiful.
whatever improves outcomes. I'm always trying to share those.
Yes.
Um, but I think I ran off. didn't answer the question. It
No, no,
was
no, no. No, you did. You did. And I love what you talked about how fathers can be an integral partner
oh,
in this as
must. Oh,
well.
and there's I have to mention this. For Kira for Moms, an organization established by a man named Charles Johnson, who lost his wife to um, basically neglectful care in the hospital where she had a C-section. So he established, and her name was Kira. He established For Kira for Moms, and now they have For Kira for Dads, an app to educate fathers, a free app for fathers to educate themselves about how to support and advocate for their wives and their partners and their whoever is in their family that they want to support. It goes from first trimester to the fourth trimester postpartum, and it even includes some of the ACT toolkit in
That's
that
great.
app. So I'm very yeah. So I'm even if they didn't have that, I would be excited about this. But
Yes.
there are more and more dads becoming doulas,
Yes.
birth workers,
Yes.
to
Yes.
support their wives. So yes, and
Absolutely.
yes, so that's something that's important too.
Yeah, I love
Um,
that. I think they are an important part of how we address what we're seeing with maternal health care and how we overcome some of the challenges and barriers. And so I have been loving seeing in recent years organizations, maternal health advocates, being more intentional about incorporating dads and partners into their training materials. Or I absolutely love that. So it's really great to hear that the ACT framework is resonating with the dads too. That is so awesome. That is
oh
cool. And
yeah,
thank you for sharing Kira for Dads. That is great. I wrote that down. That is wonderful. And so, as we
I'll
kind
share the links. I share the
okay,
links. I have all the links. It's actually we have a package of links that we give to the post workshop those who do our workshops, and they're free every last Wednesday usually. But the workshops participants get a
okay.
package of resources, including all the links to all the things that we know are helpful. Mhm.
Wonderful. I love that. And so, keeping in our same line of conversation, I wanted us to kind of shift to talking about centering maternal voices. And I thought it would be great for you to maybe share with us, in your experience, what has been some of the common barriers that our Black families face when they do try to advocate for themselves in OB settings or in other medical settings.
Well, as I mentioned, this issue of being the boss,
Mm-hmm.
um, we have this medical hierarchy, this doctor-patient power differential. Um, that it's sometimes it's the person who's getting care is scared to say anything. Sometimes the doctor has a way or ability to shut them down.
Mm-hmm.
The first of all, it's a well-known statistic that a doctor will interrupt somebody um, almost as soon as they've had a few seconds to talk. So that is a real problem. It's well-known problem. But paternalism and medical hierarchy combined with misogyny and racial bias, homophobia, xenophobia, all of these are all making birth, mainly in hospitals, traumatic and even dangerous because they're not listening. Everybody knows the story of Serena Williams where they were not listening to her. So the question is, how do you get people who dismissing your symptoms? How do you get them to listen? How do you deal with those barriers? But those are some of the barriers. They're busy. Well, sometimes you could say, well, they're so busy, they're overwhelmed, but you have to be the squeaky wheel that gets the grease, as the saying goes. Um, and the issue that if you disagree, that they're going to take offense is also a problem. The issue that they're going to uh, act like, oh, if say the father speaks up for his wife, they're going to be calling security on them. This was something that Charles Johnson was concerned about, not being too loud, not being too assertive, because then so people we want to figure out a way not to be policing our voice. We want to
Mhm.
speak up when it's necessary, no, and speak up in a way that they can't not listen. So one of the things that want to overcome the barrier of the not listening, sometimes we have to say something like, I don't feel safe in this hospital because you're not listening to me. Or, and I'm just telling you some of the things that have come up in our workshops. Um, I would like it noted in my chart that you are refusing to provide care, or you are refusing to. So you want to do those, sort of throw your weight around in a way that they feel that, oh, okay, um, think twice about denying her this or that. I'll think twice about because, she's. I'll think twice about it because she's brought her husband, or because her sister is on the phone. So having someone on speaker even is better than not having anybody with you to make sure that your voice is heard. So those are some of the barriers.
Yeah.
This
And
the
those are
busyness.
huge. Yeah, those
Yes,
are
yes,
those are huge
and,
issues, and
and
I
it's
think.
it's directly descended from the days of slavery.
Mhm.
Really, this type of devaluing the other person,
Mhm.
and generally speaking, it's the black person or the brown person, immigrant. Um, so this and the paternalism, controlling women and birthing people as if they have no autonomy. This is part and parcel of obstetrical care.
Mhm.
So that's where we need this paradigm shift that Dr. Scott talks about. So and then the medical hierarchy, where the doctor says goes, and
Mhm.
doctors and nurses and doctors in training are discouraged from speaking up. So all of this is worse if you're from a marginalized community, especially for
Absolutely.
Black folks. Yeah.
Yep.
So those a lot of this barrier. The barriers are
Are
pretty
significant.
bad.
Yep. Are
Yes.
significant.
Yes.
They are great. And I mean, I agree with you wholeheartedly. And then all of those things that you mentioned are the conditions in which um, communities like ours have developed a sense of mistrust, right? We have historically mistrusted healthcare systems, and because of all of the things that you just shared, I'll add on to, and that's why I love the ACT framework as well, because it reminds us to kind of decondition ourselves, because I think we've been programmed and conditioned, like you said, to doctor has our best interest at heart. Like, this is a doctor, they're that power dynamic comes into play, and so that ACT framework reminds us, to speak up for ourselves if we're uncomfortable about something. Trust your body, trust what you're feeling, and that's why I think it's such a great tool for mamas as they enter into these spaces to have to kind of help coach them to through these uncomfortable conversations that they may have with their providers. But I'll also say, just to add on to that piece, most facilities do also have things like peer navigators and patient advocates. And so sometimes if you feel that you need to talk to a peer navigator or a peer advocate to help support you through some of these conversations that you have with providers, or even to even report a negative experience, they are there for you to help you through that process. And if you have had a negative experience, most facilities have some type of protocol that allows you to file a complaint or to file a grievance. And I mean, that's another way that we can drive systems change by, reporting like, this was done to me and it was wrong, and I want you to know that it was wrong. So yes to everything that you're saying. We only got 5 minutes left. I could not believe it. Something that I kind of wanted to end on is maybe you sharing with us, what can we do? we're gonna try to move forward and use storytelling as a tool for systems change. But how can we all contribute? Like, what can health educators, social workers, doulas, what can we do to help elevate a mama's story or patient stories in ways that's helpful and transformative?
So we want to shift the culture of perinatal care using cultural interventions like ACT. You can use the Kimberly Seals Allers, who has the Earth app. She also has the Birthright podcast. So I think we need to um, turn down the fear and start to uplift the positive stories. That's one thing that we can do as a community, and we can also support the families in our area. Um, we support the Black birth workers like doulas, who are providing birth space security for Black families, protecting their stories and their rights. Black women are the vanguard in the movement to transform perinatal care and restore the joy and power of Black birth and midwifery. So we've got to keep all of this going, almost like the civil rights movement. Do things like they did for the Montgomery bus boycott. We have to, as the more folks are educated and advocating for themselves, the more reviews we have in the Earth app. So it's like all of using multiple avenues for change at the same time has to happen. So the community members, individual patients and families, if they're equipped to advocate for themselves, that's pushing for change. If we have more and more Earth app reviews and data being shown to the hospitals through those reviews, then they will start to change. I believe that they're not going to change because they know, racism is part of the care. It's people don't change when they see the light. They change when they feel the heat. So we have to bring some heat to bear on those systems.
Absolutely, absolutely. Well, you guys, I cannot stress to you enough how much of an honor and treat it is to have Dr. Farrington with us. I know she's extremely busy, so her lending her voice, her expertise, and times. I took a lot of notes, y'all. Like, I got a couple of things I need to go back and look up, like that Earth app for sure. I'm about to go and look into it and share it about 10 more people. But thank y'all so much for tuning in and joining us. I wanted to allow Dr. Farrington the last few moments to maybe share with folks how they can connect with her and follow her on all of her social media platforms.
Well, we're on Instagram at BC4, the number 4, SM _ and just look up Black Coalition for Safe Motherhood and LinkedIn, Facebook, and go to our website, join the workshops. And that's the story.
Wonderful. Thank you so much. We appreciate you. We value you. You are a true treasure to the maternal health space. And with that, you guys, we're going to close things out. We hope to see you next month. Have a great afternoon. Bye.